Welcome to Facial Plastics Friday. It's Dr. Brace here, and by request, I'm discussing neurotoxins and fillers. So what are neurotoxins? These are Botox, Dysport, and Xeomin. These are the main cosmetic neurotoxins we have in Canada. Sometimes they're called neuromodulators. They're all three type A botulinum toxin. All three are basically a muscle relaxant. So when used appropriately, they reduce the lines in your face. The lines that you should be targeting with these are the lines that are produced by muscles and their motion. So in the forehead, raising your eyebrows produces these lines. Between your eyebrows, the scowl muscles produce these lines, and when you squint, you get these crow's feet. And so these neurotoxins or neuromodulators are great at softening those lines. You can use it in the lower face, but you have to be really careful, because if you're not careful, you can give someone a facial asymmetry in terms of their smile, a droopy lip, some trouble pursing their lip when they're trying to drink or speak. So make sure you see an expert. All of the neurotoxins last on average about 12 weeks, 3 months. They're all temporary, so if you love it, it's unfortunate that you have to keep having it done, but if you hate it, it's gone in 3 months completely and you're back to normal. There are very few complications with neurotoxins. It's a very, very safe class of medication because complications will only last 3 months, and all the complications are basically weakening a muscle you didn't want to weaken so that you could get a droopy eyebrow, eyelid, or double vision if somebody puts it too close to the muscles inside your eye. In terms of fillers, these are not neurotoxins, but they're gels that bind water. So my two most common fillers here at Well Facial Plastics are Restylane Lift and Kiss. Use Kiss in the lips, obviously. Use Lift because it's the highest G prime, or the stiffest filler on the market that we have now for enhancing cheekbones and chins and temples. There are other products made by Restylane for tear troughs and for adding softer volume in the cheeks, and we use all of those as well. And I'm very excited to share with everyone that we've brought in Reveness, which is a Canadian company, and so they're made right here in Ontario. It's a hyaluronic acid filler that does the same as the Restylane or Juvederm or TSCL, any of those companies, but it's Canadian made. So I like using fillers where we have volume deficiency, so tear troughs, flattened cheeks, flattened cheekbones or cheekbones that want to be enhanced, lips, chin. All those places are great spots to put filler. I do not like it in the upper lip here, in the white lip. If you have lines here and you're putting filler there, you are eventually going to look funny. You're going to look simian or monkeyish, and so there are better strategies to address upper lip lines than filler. I don't like filler in these lines. It's a very dangerous spot to inject. And speaking of danger, make sure you see an expert injector if you're looking for neuromodulators or for hyaluronic acid fillers, because there are some vascular emergencies that can happen, and your injector should always have hyaluronidase on stock in the fridge at their clinic in case of such emergency. So that's it. Send us your questions if you have any, and I'll do my best to answer them today and tomorrow as they come in. Have a great weekend, everyone.